The regenerative medicine revolution. This is Brian with Life Balance Medical Center. Knee pain. I tell you what, this is a serious problem. I'm sure if you thought about it just for a second, if you're not already dealing with knee pain, you know somebody that is. Check out my previous video, some of those videos that show some images of what knee surgery actually looks like. So the question is, how do you help that knee without surgery? Well, with regenerative medicine. So what is that? Well, let's focus on stem cell therapy. There's more to regenerative medicine than just stem cell therapy. But let's start with that. Stem cells, they can basically become cells of any tissue, from bones to tendons to glands, organs, nerves, you name it. Whatever your body needs is what they can become. But we're talking about your knee. Have you been told you're bone on bone? I hear that one a lot. So let's say you're bone on bone. Let's say that you got a problem with the bone, the muscles, tendons, all that type of stuff is damaged. Well, the good news is, look, we're covered here. Because as you can see, this stem cell can become any of these, no problem. But there are different types of stem cells. But to save time, we're only going to talk about what we use here in our clinic. So we're going to use what's called mesenchymal stem cells. We use these because they are the best for joint problems. We've been talking about knees, and the knees are a pretty important joint, so that's why we use those. But where do they come from? A lot of people are really afraid of the thought of stem cells. They've heard all these crazy bad things about it. So mesenchymal stem cells are harvested from what's called Wharton's jelly. This is part of the umbilical cord. So from a live, healthy birth, the Wharton's jelly is harvested and the stem cells are taken from there. So totally healthy baby, nothing crazy like that, but the mom's checked, the dad's checked, the baby's checked. Then they screen the cord and the cells themselves to make sure they're all pure and there's nothing bad in there. That is where buying from a reputable company is extremely important. So ask for more details if you have any questions about that, but we'll be more than happy to help you out. So let's decide that you've had enough and that you want that knee to actually start working again. This is a simple in-office procedure that can be done in about an hour. No anesthesia, zero recovery time, and we see improvement in function in usually about 1 to 3 months. As far as side effects go, every patient so far, the only complaint that we've really gotten is a possible injection site swelling, maybe tenderness there. In the next video, I'm going to show you I'm going to talk about some of the experiences that we've seen with patients and some typical before and after x-rays. And we'll stay focusing on the knee as well. That's all I got to say today.